Hello guys, welcome and welcome to Metier International Academy, one of the leading academy training nurses in the nursing competitive exam as well as IELTS and NCLEX and OIT training. So today again we are going to start with the magic pill session. And now today the first question what we are going to discuss, the brainstorming question what we are going to discuss is the practice of keeping mother and child together immediately after birth is known as. Again we are going to start with the pediatric. So in the last session also we discussed about the pediatric. So today also we are going to continue with the same pediatric previous year question paper discussion. So here the question is the key point. Always we used to search for the key point in the question, right? So here keeping mother and child together after birth. That's all. So that is the key point. So what it is called as? It is a direct question, and here the options. Let's see the options: rooming in, puparium, lying in, bonding. Okay, so these are all the four options they have given here. Among this, the right one is option A, that is rooming in. So why we selected rooming in? What is the rationale behind this? Rooming in, it is also called as what? Bedding in is the practice of keeping the mother and normal newborn soon after the birth. Once after the delivery of the baby, immediately keeping the baby over the mother. Okay, in order to create a bond. And research says that if any separation in this initial hours may cause a harmful effect of successful breastfeeding. Successful bonding will not be there. Successful breastfeeding will not be there. That's why immediately we are keeping the baby once after the delivery on the mother. Okay, so that is called as what? This procedure is called as what? Bedding in. It is also called as rooming in. Okay, guys. The next question is, this question asked in LNJP nursing officer exams. And the next question is, select the criteria that is coupled with its indication of the gestational age or birth weight. So according to the birth weight and according to the gestational age, which is correctly associated. So that is what we are going to see now. So let's see the option and then we can decide. So these are all the four options they have given here. Small for gestational age, large for gestational age, low birth weight baby is appropriate for gestational age. So you should know the meaning of what is small for gestational age, what is large for gestational age, what is the meaning of low birth weight baby according to WHO in India, appropriate gestational age. So if you know the meaning of all these four things, then only you can answer this question. Okay, fine. So in the first option, they said that small for gestation age, the neonate weight is less than 20 percentile. That is the wrong one. What is the meaning of small for gestational age? Let me show the rationale so that it will be easy for you to understand immediately. For this, the correct answer is option D, that is appropriate for the gestational age. Appropriate for the gestational age, the neonate weight lies in the range of 10 to 90 percentile. So this meaning is the correct one. This definition is the correct one. All other thing like the first option, small for gestation age, that is weight less than 20 percentile, it is the wrong one. Okay, large for gestational age, that is the infant weight more than 99 percentile, that is also a wrong statement. Low birth weight, the infant weight is less than 1500 gram at the time of delivery, that is also a wrong statement. According to WHO, low birth weight baby means what? Less than 2500 kg. Okay, whereas here they have mentioned low birth weight baby 1500 grams. Okay, so this is the third statement, is the wrong statement. All first three statements, A, B, C, are wrong statement. Why? What is happened in the first two? Small for gestation. See here I have given the exact statement. Small for gestational age, it is also called as small for date. We can either call it as small for gestational age or small for date. Okay, so here the birth weight less than 10 percentile, that is called as what? Small for gestational age. So whenever this small for gestational age question is coming there, immediately you have to think about birth weight less than 10 percentile. Birth weight less than 10 percentile, that is called as what? Small for gestational age. The next one is large for gestational age. What is the meaning of large for gestational age? The birth weight greater than 90 percentile, whereas here in this option what they have mentioned, more than 99 percentile. Actually, what is the exact definition? More than 90 percentage is the correct word. Okay, large for gestational age means more than 90 percentage. Okay, small for gestational age means less than 10 percentage, whereas in the option both the things are given wrong. And which is the right answer here? Option D, that is appropriate gestational age is the birth weight between 10 to 90th percentile. Okay, actually what they are doing, you know, they are means associating the gestational age and the weight. Okay, so according to that association, which among the following statement is correct? So this is what the question they are asking. For that, the right answer is option D. That is, the neonate weight lies between 10th to 90th percentile is called as what? Appropriate for gestational age. Okay, guys, fine. So this question also asked in LNJP nursing officer exams. The next question is, the preterm infant elbow may easily brought across the chest with no resistance is called as. So here in this question, the keyword is the preterm infant is present. The keyword is elbow. The elbow is brought across the chest. Okay. The elbow is crossing the midline and brought across the chest. It is crossing the chest. It is crossing the midline. Okay. So without any resistance, there is no resistance at all. Okay. While the examiner is doing like this, easily the elbow is crossing the midline and coming across the chest. So what is called as? It is called as, they have given 4 options: sunset sign, grasp reflex, scarf sign, and tonic reflex. And here the right answer is option C, that is scarf sign. Here in this image, you can see very clearly, it is a newborn assessment finding in which the infant elbow crosses the body midline without any resistance. Clearly, I have given the meaning here. Okay. As the examiner draws the arm, easily the arm is crossing the chest and reaching the opposite shoulder. Okay. So this is called as what? Scarf sign. What about sunset sign, grasp sign, tonic neck reflex? So while we are discussing the question, we have to discuss each and every option. Then only it will be easy for us to remember the rational, right? Fine. So let's discuss the other options, rationals also. Let's start with the sunset sign. This question asked in RRB. Okay. So sunset sign. See here, the sunset sign is commonly seen in which condition? In case of increased intracranial pressure. Actually speaking, it is a late sign of increased intracranial pressure. Late sign. Okay. Late sign of increased intracranial pressure. So here what is happening, you know, because of excess intracranial pressure, the nerves which is supplying the eyes, which is responsible for the movement of the eyes are compressed. What are all the nerves which is responsible for the movement of the eyes? Nerve 3, nerve 4, and nerve 6. How many cranial nerves are present? 12 cranial nerves are present. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, hypoglossal, spinal accessory, and hypoglossal. So these are all the 12 cranial nerves which is present. Among these, the nerves which is responsible for the movement of the eye are oculomotor, trochlear, and abducens, 6th nerve. Okay, so all these 3 nerves are affected here. That's why the eyes are focusing down. Okay, the eyes are forced to see down. Okay, and the sclera in the top, it is clearly visible. You can see here, the sclera is clearly visible, and here the cornea is facing down. So this is called as what? Sunset sign. And next option is palmar or grasp reflex. So when it is starting, when it is ending, that is also very important. It begins at the 32nd week of gestation and it is disappeared in 3 to 4 months. Begins at 32 weeks of gestation and disappears at 3 to 4 months, and it is replaced by the voluntary grasp at 45 months. These are all the key points. Please remember that. Apart from that, if you are keeping the fingers or pencil or pen, whatever you are keeping over the palm of the neonate, immediately the fingers will grasp the pencil or finger will grasp the pen. Okay. So a light touch of the palm produces the flexion of the fingers. Understand, guys? So that is called as what? Palmar or grasp reflex. And the next one is tonic neck reflex. You can see the baby here. It is very, very simple. If the one arm is extended, the head automatically turns towards the extended arm and another arm will be flexed. One arm extended, the head turns towards the extended arm and another hand is flexed. So this is called as what? Tonic neck reflex, and it will disappear in the month of 4 months. Okay. So these are all the rational of other options. Okay, guys. Hope everyone understand the rational. Right? Fine. Next, move on to the next brainstorming question. After the minimum period of gestation, a preterm infant can be directly put to the breast for adequate breastfeeding is. After the minimum period of gestation of a preterm infant, here they have mentioned very clearly the baby is a preterm infant. It's not a term infant. Term means once it is crossing the 37 weeks of gestation up to 38 to 42 weeks of gestation, it is a term baby. So less than 37 is a preterm baby, right? So here they have already mentioned the baby is a preterm infant. Okay. Can directly put whether the preterm infant can give the or can take the breastfeeding or not. This is the question. Preterm infant can take the breastfeeding or not. So if the preterm infant can take the breastfeeding means at which gestational age preterm infant can take the breastfeeding. Preterm infant breastfeeding எடுக்குமா எடுக்காதா எடுக்கும் அப்படின்னா எந்த gestational ageல பிறந்த அந்த preterm infant breastfeeding எடுக்கும். இதுதான் வந்து question. சரிங்களா? So let's see the options. 30 weeks, 32 weeks, 33 weeks, 34 weeks. 4 options they have given here. And here the right answer is option D, that is 34 weeks. So why we selected this option? The rationale behind this is fine. So clearly I'm given the according to gestational age whether the baby preterm infant can take the breastfeeding or not. So that explanation I'm going to give now. Please listen carefully. The gestational age, the preterm infant born less than 28 weeks. Okay. So here there will not be any sucking reflex. The sucking reflex will not be there. Even the gut motility will not be there. The baby who born less than 28 weeks of gestation, sucking reflex will not be there. Gut motility will not be there. Then how the baby will do the breastfeeding? IV fluid is the only option. And second one is the gestational age, the preterm infant born between 28 to 31 weeks of gestation. What weeks of gestation? 28 to 31 weeks of gestation. Here, development of sucking reflex will be present, but the coordination between the sucking, breathing, swallowing, it will not be there. See, while doing breastfeeding, while taking the breastfeeding, definitely sucking reflex should be there. Second one, breathing should be there. Third one, swallowing has to be maintained. All these three things has to be maintained simultaneously. But here, the gestation preterm infant born between 28 to 31 weeks of gestation, only the sucking reflex is present, whereas the coordination between the sucking, swallowing, breathing is not present. So here also what we can do? We can go with the orogastric tube feeding. Orogastric tube feeding. The next one is the preterm infant born between 32 to 34 weeks of gestation. So here, sucking reflex will be there. The coordination between breathing and swallowing will also be present, but not up to the mark. So we can go for what? Palade feeding or spoon feeding. And the last one is gestational age up to or more than 34 years of gestation. So here everything will be normal. That is sucking reflex will be developed adequately. And the next one is breathing will be there, swallowing will be there, everything, the coordination will be present. So this time there will not be any problem in taking the breastfeeding. So the baby who born above 34 weeks of gestation, so those preterm infant can go for what? Normal breastfeeding. Okay, guys, fine. So here, which is the right answer? Option D, that is 34 weeks of 34 weeks is the correct answer. This question asked in PGA, Chandigarh. Okay. The next one is a direct question. The baby friendly hospital initiative. In short, in the exam also they will be giving in the short form because this is very familiar terminology. Okay. So BFHI was launched jointly by, jointly means 2% joined together and they are coming forward. So overall they UNICEF and WHO, WHO and FAO, UNICEF and FAO, WHO and Red Cross. So here the right answer is direct question. So here the right answer is option A, that is UNICEF and WHO. So what is that baby friendly hospital initiative? Let's see the rationale. See, actually baby friendly hospital initiative was launched by WHO and UNICEF. Just now we saw that. The second vital point is when they launched in 1992, they have launched this one. Okay. What is the reason for launching this one? To protect, promote and support the breastfeeding. So 3 golden points over. The 4th golden point is whether they have revised anything in the BFHI. Yes. In 2018, they have revised the policies in the BFHI. So there are 10 steps. It contains how many steps? 10 steps. Okay, fine. So once any hospital who want BFHI accreditation means they have to follow the 10 steps, whatever they have mentioned in the revised 2018 policy. Okay, guys. So here, baby friendly hospital initiative was launched jointly by Which is the right answer? UNICEF and WHO and other golden points are mentioned in the rationale. Okay, guys. So this question also asked in AIIMS Patna. So thank you, guys. So far we discussed about pediatric. So far we discussed about previously asked pediatric questions. Okay. So if there is any doubt in this, you can drop your message in the comment section. And we have discussed each and every question along with the key points, rationale and golden points. Okay. So if there is any doubts, you can drop your message in the comment section. And thank you very much for watching this video, guys.